I wish that mental health started to have less stigma. I am disappointed that it's still such an issue. The reason I say that one is because the amount of times I have seen my patients that are not doing well get fired from work, even though they're full blown transparent about what's going on with them, is pretty bothersome to me. And I've had to try and protect patients with FMLA. To me, mental health problems are the same as having diabetes or something else, and why it's treated differently, I don't get it because you can get better from it, but you need to give the person a little slack when their depression's not controlled.
Welcome to Life as a Patient Doctor. I'm your host, Dr. Stephanie Moss, navigating life as a patient and a medical doctor. Join me as I interview other doctors, students, and healthcare workers on their own journeys. Listen to their unique stories on how they balance their health while caring for others in the health profession. Welcome, everyone. Today, I'm interviewing Brie. Brie is a psychiatric nurse practitioner, and she is very passionate about mental health. She knows that mental health is more than just medication. It requires a thorough background, physical elements to be addressed, and the right form of therapy in order to see marked improvement of symptoms. With Brie, you'll be able to feel as though you are part of the decision-making process and decrease in symptoms and improvement in daily life. Using a biopsychosocial model and a strong belief in neuroplasticity, Brie can assist with helping individuals find their stability and their happiness. Brie is a strong passion for childhood trauma, depression, anxiety, and post-traumatic stress disorder. She assists in psychiatric medication management and focus on promoting personal growth. She is always assessing ways to make further adjustments to the care plan in order to support the fluidity of daily life and new stressors. Welcome, Brie. Thanks for coming on.
Sure.
Now, I would really love to just hear your story and specifically about your background and journey into the field of medicine.
Yeah, so my background as far as medical stuff goes pretty far. Some of my first memories as a kid are probably OCD thoughts, but I didn't really know that until I was in my late 20s that other people didn't think like that, which is often what I see with my own patients. They don't realize either. I also had a lot of signs of Ehlers-Danlos when I was a kid, but my parents often would dismiss symptoms that I had. And since I had my own looping thought processes, I often dismissed them. And so I progressed pretty far into symptoms of quite a few things before I actually had them addressed. So probably everything started with some knee dislocations when I was putting on shoes that I managed to pop back into place and my parents just went on their way. But looking back on that, obviously not normal. I also developed significant period pain and heavy bleeding. When I was younger, that just was written off as normal. And that eventually went to pelvic pain. And then the EDS, meaning Ehlers-Danlos, progressed as well. In adulthood now, I tend to have a lot of pain and spasm.
That sounds horrible, but thank you so much for sharing that. Those are all types of health conditions that are not commonly addressed for a
No.
long time.
Yeah. And I have a lot of comorbid conditions of Ehlers-Danlos as well. I'm on my second episode of significant tachycardia that isn't well controlled by metoprolol, which they can't figure out why. And they're debating whether it's an electrical issue with my heart and whether I need to see an electrophysiatrist. I've been having episodes of dysautonomia quite a bit. I've had quite a lot of gaslighting from doctors as well in my 20s when I did actually try and get things addressed, including recently ended up in the emergency room because I had a 3-month period. It got severe and was borderline hemorrhaging, and my doctors all told me it was normal. It was not normal. I had a very large polyp that was hemorrhaging. So yeah, I've definitely had a lot of medical trauma, to say the least. I probably am going a little bit disjointed because there's many pieces to me. My dad passed away very suddenly when I was 25. And so there is a component of PTSD as well. Because I was very good at masking symptoms, I also didn't know I had ADHD either, which came out when my dad passed because obviously your functioning goes when you're under intense stress.
I'm so sorry. That sounds so painful. I'm so glad that later on they were able to address those symptoms, but
Yeah, for the most part, some of it's still in flux. The pelvic pain for me is always a very significant issue, as is generalized pain throughout the day. There's not really a ton that controls it. It does get expensive, which is the yucky part because it's time intensive and expensive when you need massages and PT all the time.
Right. No, I very much can appreciate that as a patient with pelvic pain myself. It is a
Yeah.
long journey. Has your own health conditions influenced your journey into medicine?
Definitely. I actually consider my strengths to be my listening skills and making sure that I'm giving off like a strong amount of empathy because coming from someone that's been gaslit by the medical system for so long, I am very good on making sure that all questions are answered, that my patients feel like they're taken care of. I also tend to go probably above and beyond. If I get a patient that's complaining of pelvic pain, I tend to make sure, never stepping outside of my scope, of course, but making sure they have the doctor connections that they need, the resources that they need. So they're not just sitting there with these unaddressed problems that another doctor is just saying is fine.
Yes. Oh, that's great. And exactly what you said is just providing the resources and connections. That's really
Yeah.
where the benefit is by having that personal experience or seeing other patients with those health conditions instead of just pushing them along and
Yeah.
feeding into that bias that it's normal when these are not normal things and people need support. So I'm so glad you're able to use those strengths into your practice.
Yeah. Definitely.
Was there a reason that you ended up choosing becoming a nurse practitioner and then also specifically for psychiatric?
Yeah. Psych definitely goes back really far for me. I couldn't figure out what I wanted to do in college. I had about 4 to 5 majors, just didn't really love any of them. Eventually ended up in neuroscience after realizing every paper I was writing seemed to be focused on the brain. And so it just cascaded from there, getting to the end of my degree and going a bachelor's in neuroscience sounds cool, but you can't really do much with it. And most of my jobs prior to that involved working with people. So I just realized that the way to marry those two together was to go towards psych. And I've always been a psych nurse. I've been in the field for almost 10 years now. And that's all I've ever done. And I've worked every setting, involuntary to voluntary, outpatient, inpatient, substance use. And I also worked leadership positions as well. And eventually, after I felt I had enough experience as a nurse, I went for nurse practitioner because that had always been my goal was to be a little bit more in the driver's seat and to open my own private practice, which I've done, but it came way sooner than it was supposed to. My hand was a little forced, so I had to. But yeah, so it was very much lined up and just nicely cascaded towards that.
That's amazing. I love hearing kind of that progression of going from college, finding your passion, finding your niche, and then going into the field and finding again what are the things I like, what are the types of patients that I like, where do I connect, and then how can I keep doing what I love.
Yeah, exactly.
I know you mentioned your unique perspective on patient care. Could you talk anything more that maybe you notice of connecting with patients?
Yeah, I think one of the things I do, and it's not that other people don't, I try really hard to make sure that my decisions are partnership decisions with patients. I don't really prescribe and just go, this is the med that I feel that you need. I tend to be really big on giving a couple different options. So if a patient's presenting for depression, I might not just say, here's your Lexapro, I'll see you in a month. I'm probably going to give you a couple options and I'm going to talk about why this option would be better than the other ones and what the differences are. And then let the patient kind of make their own educated decision based on the options that I give. Of course, never letting them decide without my guidance, but I'm big on collaborative care. I have elongated appointments, so I do spend a lot of time on education. PCPs obviously don't have the time to do things like that, but in my own private practice, I can. So I would say that's the major difference. I also am weirdly known for helping patients come down off of psych meds too if they're on about 5 or 6, which unfortunately seems to be a pretty big standard, which I think is a bit of over medication, to be honest. So I tend to work really closely with patients on altering those medications, getting the list down to 3 or less if I can. So yeah.
That's great. I love the collaborative nature. I am very passionate about too. I think that is one of the things that we should be focusing on the most with patients is making sure that we're not just the provider coming in and saying we know everything. They're the
Yeah.
experts in their own experience. So that
Yeah.
collaborative, their greater chance of continuing on with their own medications or own treatment if they have some buy-in, if they have some decision making.
Yeah, absolutely.
You mentioned the biopsychosocial components in your practice. You want to talk more about that?
I use the term lightly, in a way. What I'm getting at by that model is I'm really big on collaboration of care, not with just my patients, but also with other providers. The reason I say lightly is because I find it's always really hard to complete that piece for whatever reason. It can come down to a PCP not calling me back or another provider not being worried about it. I guess an example of where it tends to fail the most is women on birth control complaining about psych issues around their period and me being left by myself to deal with that when it probably could use a little buy-in from the OBGYN. But the intent is that I like the PCP being the hub. I like that they refer out to specialists, but my goal would be more communication than I get, and often it's just not there.
Yeah, it is hard. No, I appreciate that. It's something that we're all trying to in medicine and to do more of because people don't just have the biology, don't have the psych, they have to live on their day to days. And so that means that if they see other providers, we need the whole community to support. You mentioned that you have your own private practice. How has it been different working in a private practice versus not?
Mostly me being able to do things how I want as far as length of time of appointments, how much time I want to spend outside of those appointments on patient care. I do tend to give a lot more time to patients than I've seen in other settings or even in the settings that I've worked in. Like I would be held to the gun as far as 15-minute med checks, no time to really come up and breathe and do good documentation. So I would say that's, one of the big differences. I also have found too that having my own staff and treating them a certain way makes them tend to perform better and also give better care when it comes to patients calling in. So that's also another big thing too. Like my front desk person's very invested in my business and that shows. And I think that also the person running your phone is the face of the business, really. So I think that's important and something I saw that was different. I hesitate to say more because I've worked in a couple different settings where bosses were a little bit more abusive. And so I think that one of the main differences I saw was not getting attacked for things all the time, being forced to document very specific ways that would take a lot of time. And not to say documentation isn't important, but I had a boss who was making me redo the same note 5 times in my own free time on the weekends. And that leads to burnout and poor patient care eventually. So, yeah, basically the freedom to practice how I want and do it in the way that I feel is good for the patients and calling it a day.
That's really helpful. That's a really good perspective. A lot of individuals that I've been speaking with in this podcast have actually transitioned to private practice, and a lot of similar things are coming up.
Yeah. I've got a lot of friends that have actually been considering leaving community mental health and coming to a setting like mine because of the way that I talk about it. Of course, there's all different types of psych patients, but one of the things that I hear the most that they are bothered by is the amount of patients that hate them and just yell at them all day. And I don't have that because my patients want to see me. It's not like an involuntary setting. So, yeah, that's one of the benefits too.
So it sounds like you do mostly outpatient psych.
I do all outpatient, and I also tend to specialize, like how is in my bio, where I tend to do mostly OCD, PTSD, depression, and anxiety. That's one of the big benefits of my own private practice, too, because I have the capacity to specialize and to be really good at a couple things instead of having to somehow be amazing at all of them. Because the DSM is big, not as big as what medical doctors have to deal with, but it's still big. And I still treat those other patients. If I have someone who's bipolar, they still get good care. But do I claim that's my specialty? No, I don't. I'm actually the best at the diagnoses that I have, which is a weird perspective, but it takes one to know one. So I tend to hang out in those categories because I can personally relate.
Yes. Can you talk more? Right now, I've been doing a lot of research on personal disclosure, when and how to personally disclose, whether or not to disclose.
Yeah.
Can you talk
Yeah.
about that? I would love to hear your perspective and
Yeah,
experience.
it's an extremely loaded topic, and I find that everyone has such varying opinions. I was taught from the get-go that you don't share a single thing ever about yourself, but I also came from working the highest acuity facility in my state when I first started, so those are not the patients you wanna do that with. I tend to use it when if my patient is, say, acute case of OCD, and they're having all these loops about not wanting to take medications, that would be one of the times that I whip it out of my pocket because I'll actually throw out that I used to be on medications. It doesn't have to be permanent. There are times that It can be helpful. And sometimes I find that by showing my human side with that, they realize that there's people out there that they believe are in these high up positions and are perfect, but they actually aren't perfect. They have their own stuff. And that usually tends to get me a lot of buy in. So I'll do it then. Or if a patient's really struggling, say, I have a couple patients, their parents died young. I tend to share it in those cases because usually with trauma, they often feel alone and isolated. But I wouldn't say that it's ever this in-depth conversation. I'm very careful about it because the appointments are not for me, they're for them. So I think the best piece of advice I ever got was, does your share help the patient or help you? And so I tend to give short little curated things about myself to bridge that connection and to help them feel supported, but then I cut it there. They don't get details about like how my dad died, what was going on with that. It's usually pretty surface level of just, hey, I get it. And I'll use it in a very pointed way.
That's really helpful. Surface level, pointed, really focused. I like what you said of, does this particular disclosure or sharing help the patient or does it help me? And I agree with you. I think it's so important to be very cognizant of
Yeah.
why you're doing it and also know there is some benefit. This is a tool be able to share a human experience.
Yeah, it's definitely a tool, but it's double-edged because you'll always hear those patients too that complain. I often hear it the most with therapists where patients will tell me, "Oh, my therapist talked more about themselves than they did me in that session." That's why I'm careful about how long I'm even sharing. I guess another tip I would say is I keep it like 3, 4 minutes tops if I'm saying something about myself. I think 5 is almost too much. And I always gauge how the patient's reacting to it too. If they seem engaged with it, that's more likely for me to expand that their body language is more closed off because some patients like that and some actually hate it.
That's a good point. So that's really helpful to know. Practice set amount of time, know when it's too much, and be very focused on how the body, how the patient is reacting, and if it's in the moment, being
Yeah.
very mindful of how they're acting. Thank you so much for sharing that information. That is really helpful. And I think a lot of people, no matter if they have a health condition, a mental health condition, like I think that is something in the medical field in general of struggling with that double-edged sword, like you said. Those are some really good tips. Thank you.
Yeah, it's definitely bitten me before in the negative way too. I can share an example of that. With my health concerns, there are times when I start not doing as well and I can be prone to migraines. I think I had a patient that got hit, I don't know, maybe 2 or 3 times pretty consistently together. She just happened to on a monthly basis, and for some reason, it just happened that every time she was scheduled, I got her. And we told her, like my assistant told her, like I was having migraines and just was struggling a little bit to empathize and just not that I didn't want to show up to work because people make odd assumptions sometimes. And she ended up throwing it in my face a little bit later and saying she felt she couldn't come to me and ask for med changes because I had too much going on. And granted, this was a little bit of a projection because she had changed her meds without telling me when she had full access to me and could have just come to me. So it did seem like a bit of an excuse. But again, that's the other side of it where it's like, what is too much sharing? Because then you can get comments like that, which are really not helpful to patient care.
That is hard and is definitely, I think, the biggest challenge that mental health or struggle with because, especially with trauma and just humanity, a lot of emotions can be thrown around. And if you're not able to meet with them, then they feel abandoned. Those emotions can then come at you, and you are abandoning them in that moment. So it's like
Right.
this
Yeah.
duality of what do you do?
There's no good answer with it. I feel guilty every time I have to call out, and it feels yuck to me. I like to be consistent, so I never feel good when I have to do it.
But I think that's important to know is you are a person. You do have to take care of your health first because when you're having a migraine, you can't change their medications or can't
No,
be a good health provider.
but some depending on the psych patient, they don't get that. They just expect you to show up and that you never have anything going on besides them. But and I say that lightheartedly. There are my few that are like that.
No, I totally get it. How do you decide when it is appropriate to take time for your health?
Oh, do you mean just like calling out or do you mean taking a vacation or both?
Both are good. Whatever you want to go with.
I would say for calling out, if I feel that my decision making would be impaired because of how I'm feeling, that's my number one. And that's usually my call it quits point is if I feel like I might maybe mistake is a strong word, but just feel like I'm not going to be fully present and the patient would notice, which I rather would be there at 100% or not at all. That's just how I am. So that's how I make that call. But I try really hard to push it. Unfortunately, if I've called out in the past month, I will push myself harder to stave that off if it's too soon. I haven't been calling out monthly in a bit, but I was a couple months ago because I was not doing well. Vacations, I've been trying to take a week off every 3 or 4 months, but unfortunately, because my business is newer, what ends up happening is a lot of that vacation time tends to go to catch up and things like that, which I don't recommend, but that's just being honest about the situation. But I definitely think a full week off of doing nothing here and there is super important to avoid burnout, because if you're burnt out, you're not gonna give good patient care, and that's just a waste.
That is really helpful, knowing what your body needs. Did it take you a while to learn that's what you needed?
Yes, because going back to how my parents were super dismissive of my medical stuff and like how you're fine, nothing's going on with you. I was raised that like my parents didn't take vacations, my parents didn't call out sick even when they were sick. So it took a really long time just mentally to break some of those patterns. And I tend to be extremely hard on myself, which can be common with someone with OCD or ADHD as well. So nothing tends to ever be good enough for me either. So it's hard to fight off those mentalities, but I'm better at it than I used to be.
It's all learning experience.
Yeah, we're all human, it happens, but yeah, I definitely am. My OCD is decently controlled at this point, but do I still have that, like, massive perfectionism and, like, needing to be at 100%, firing all cylinders at all time, even when that's not reasonable? Yeah, I try, and I usually crash and regret it later, so I'm trying to be better about that so I don't have that.
I very much resonate with those words. Yes, the perfectionism, as a person and as a healthcare provider, it's hard. It's hard
It is.
to learn that you need to take care of yourself. I like what you said of need to take care of yourself to prevent that burnout, which is so
Yeah.
common when you're just giving and giving and giving so much of yourself. Like you said, we're all human.
Yeah, and if you think about it too, I've actually read a lot of interesting articles recently about how the healthcare field in general, we're almost taught to do poor self-care. It's like it's expected of us to skip our lunches, to work these long shifts, especially nursing. It's like a common thing. Like, I remember when I did emergency room psych, lucky if I got a lunch. Like, I really often didn't, and we would all get cranky because and that's not okay, but that's what we're all primed to do. And if you don't do that, it gets a little bit frowned upon, like you're not seen as good as other people.
Yes, very much. I couldn't believe it when I started to learn that other residents, other attending, there is no break. There's no bathroom
No.
break. There's no snack break. There's no food break. Like you said, you're supposed to work during that time. If you find time to eat, you're eating while doing notes.
Oh, yeah, absolutely. Or when a patient's talking to you over the nursing station. Oh, yeah.
As we start to close up, are there any other thoughts you have in regards to breaking stereotypes, promoting diversity, or humanism in medicine?
I wish that mental health started to have less stigma. I am disappointed that it's still such an issue. The reason I say that one is because the amount of times I have seen my patients that are not doing well get fired from work, even though they're full blown transparent about what's going on with them, is pretty bothersome to me. And I've had to try and protect patients with FMLA. And it makes me sad. I've also experienced it myself. Like when my dad had passed away, I actually had been promoted to a charge nurse position. Like my first leadership position ever was 2 weeks before my dad passed. And so I was trying to learn a new position. I was on a different unit than I was used to. And I started decompensating, obviously. And because it was a little bit bigger than my dad died, I actually have an active restraining order against my uncle, still 5 years later now, threatens me all the time. So it wasn't just my dad died. There was problems going on, and my grandfather just died before. And I was denied FMLA because my dad was dead and not alive. It was a big mess, and someone wanted me fired because I got the job over them. So they took the opportunity when I was decomping to try and get me taken out. And I eventually stepped down, and this person was given my job. So I think we could do a hell of a lot better when it comes to when we're struggling, and to work on a psych floor and see how I was treated. That was really interesting and eye-opening to me about how much work we need to do around that. Because to me, mental health problems are the same as having diabetes or something else, and why it's treated differently, I don't get it, because you can get better from it, but you need to give the person a little slack when their depression's not controlled. So I guess that's probably my major point, because it's something I seem to deal with every week and actually get angry because I don't like when my patients are treated like that. There's a little transference there, obviously, because I've been through it myself, but I just wish that the US in general did better when it came to when people are not doing so well.
Yes. Oh my goodness. I'm so sorry that happened to you. That is horrible
Yeah.
experience. And it's so sad that exactly like you said, our society does not recognize mental health as the same level of other health conditions.
Yeah, definitely not.
That's
I
why
hope
we're
one day
here,
they do. Yeah.
right? That's why we're here and educating, right? And hoping one day it gets a little bit better for
Yeah.
others.
Yeah, definitely.
Is there any final advice you have for any current or future individuals who are in the health profession or in the medical profession that also struggle with disabilities or health conditions?
That you can still do it, that it's tough, but you can, and that I probably have an ideal situation that not everybody can manage to do, but owning my own practice was my way around it. I only work 4 days a week. I can take off whenever time I need for doctor's appointments, or taking off a full week's a little more difficult because I only have my assistant. I don't have any other providers right now, but that there are ways to still work in the field and make it work, but that, of course, there's some settings that it's harder to do that than others.
Amazing. Thank you so much. I very much appreciate you sharing your experience both as a patient and as a nurse practitioner, and really showing how that amount of empathy that you provide yourself, but then also to your patient, really it demonstrates that you really do care about helping patients and helping other individuals no matter what they're going through. You said that you value collaborative nature. You value making sure that patients don't have just tons of medications. They really have the medications that are going to be best for their individual experience, that you make it a partnership. Also, we talked about disclosure, when it's a benefit and when it can harm, and how it's important to be very cognizant about what you're disclosing, how much time and space you're providing, and it being more just another tool to show your human side and compassionate. And then lastly, we talked about how you've decided also how to take care of your health, that it's taken time, but you've learned what are the things you need for your body in order to be able to provide 100% to your patients. Thank you, Brie, so much for sharing all
Yeah.
your thoughts and experiences. It meant a lot to me and gave me hope. So I'm sure it will provide other listeners. So if you're also listening, please make sure you share it with one other person, because it's important to show that we're not alone in this experience, that everyone's human, everyone has challenges, and it's important to show that there are other people that can do it, and that you don't need to give up hope. So share if this episode resonate with you, make sure you subscribe on wherever you're listening. And I like just recommending to share it with one other person that you think would benefit from these stories. If you want to contact me, you can go on my website, medpsychmoss.com, where I have my contact information, my blog, but then also resources for individuals who are patients and also healthcare providers and physicians. That way, as I get information and resources, I make sure to put it on there to help other individuals. You can also follow me on social media at MedPsychMom. Once again, thank you, Brie, so much for being with us today. And audience, thank you so much for walking alongside me through my journey as a patient and a doctor. Thanks again, Brie. Take care.
Thanks.